Hi everyone, I'm Sonia Hayre. I'm Head of Product Development and Visualisation within the Advanced Analytics Unit at Arden and GEM. So I'm here this afternoon to talk a little bit more about health inequalities and a tool that we've pulled together in the AAU team to help support one of our existing customers with health inequalities. Sorry. So what is health inequalities? They are observable differences, avoidable and unjust differences due to many factors, lifestyle, etc., gender, age, sex, genetic factors, and there's many more listed there. But there's far more than that. I've just obviously included these for now. In terms of health inequalities, I will walk through one of our tools shortly, but we've tried to embed the Core 20+5 framework as much as we can in our tool, appreciating that we are looking at the Core 20 population. We have also worked with a customer who has identified plus groups that they specifically requested were built into the tool, and also the 5 key clinical areas of focus there listed at the bottom are also within our tool. So we worked with an ICB about 12 months ago, and we clearly, in discussion with them, could see that they wanted to identify cohorts, groups that were suffering a health inequality gap within their given population. They also wanted to support interventions to try and close some of that gap, and wanted to monitor that impact by using a form of tool where they could see that impact and the output of the intervention that was placed. Also to help steer some of their discussions at ICB, PCN and Place-level, appreciating CCGs sort of forming into ICBs. It's a different way of working and kind of trying to bring everyone together from ICB, Place and PCN level. Again, to help formulate a partnership within the system, so really to get everyone around the table talking about health inequalities for that system. And that tool kind of being the pivotal sort of point that everyone turns to and works together on to feed some of those discussions. So with the tool that I will shortly go through, I just wanted to describe a little bit about the method we use. So the indicators that we have in the tool are sort of in 3 different cohorts. We have generic indicators that are around mortality, morbidity and acute events. We also have indicators that are underpinned by the Core 20+5 framework. And then we have another cohort of indicators that are actually indicators that are formed from the 5 key clinical areas of the Core 20+5 framework. In terms of the technical approach that's been applied to this tool, a SQL script has been coded and built, and that brings together the person level MPI and indicators. And then an R script is run once that output from the SQL is derived and pulled together to then perform the standardization, the SII and RII, slope index inequality and relative index inequality, which I'll describe in the next couple of slides. So if we look at so basically the measures in the tool, we look at absolute difference and relative difference when it comes to ethnicity, because we are looking at 2 cohorts. So we're looking at Black Asian community versus white British population. So with that, we simply apply an absolute difference. So what we do here is we look at the values following the standardization. For that indicator, we look at the Black Asian community and minus the value from that cohort of the white British, which is a reference group. Then we look at the relative difference, and that is really to show you how important the difference is. So the first one, the absolute, is basically a minus of one value from another, but the relative is a division. So it looks at one cohort and the other and divides the values, and that tells you how important and significant that difference is. So just an example there on the right. With regard to deprivation, we use quintiles, so a scale of 1 to 5, 1 being the top 20 deprived population. We use SII and RII, and that's because we're obviously dealing with more than 2 groups. So we have potentially 5 cohorts there, which are the quintiles from 1 to 5. So we apply our SII approach, which is using our R script, which looks at opposite ends of extreme ends of the scale for the quintiles, and then works out the difference there. So you can see here, for instance, 810 minus 121, which is 689. So that shows a 686 more alcohol-related admissions per 100,000 in the most deprived population. And the RII is basically a division of that. So the extreme values on both ends of that scale are then divided to give you the RII, which is 6.7 in this example here. So we use these measures in the tool. And a little bit more about the data that's used in this tool. So we've used SUS data, national data set, we've used PDS data and maternity services data set with some primary care data also in there. So this is our ICB level visual page that we first walk into when we open the tool. And as you can see, I've just mentioned the measures. We have the absolute relative SII, RII for both ethnicity deprivation. And down the left there, you can see the indicators listed. And I, at the moment, have selected the generic cohort. So you can see our generic indicators. I specifically, in this example, have selected maternity C-section rates. And you can see, for instance, in the example highlighted there, there are 553 more maternal C-sections within the Black and Asian community versus the white British. If I move on to the next slide, this is now down to place level. The places have been taken, sort of hidden from this, but they would be listed down the side there. So again, you can start to drill down into that indicator from an ICB down to a place level to see which place you are potentially seeing the variance and where potentially there needs to be some work or further analysis that needs to be done. So in this example, again, I have maternity C-section highlighted, and we can see there are 722 more for that specific place, C-sections within Black Asian compared to white British. And this is down to our PCN level. Again, PCNs have been hidden from this, so you can start to really get try and tell a bit of a story about an indicator to see it from an ICB, a place and a PCN level. So again, you get the same tooltip description there to tell you how many more there are in a specific cohort, and then you can see the breakdown according to the quintile, so from quintile 1 to 5. So that's a tool as it is currently in its current form as a minimal viable product, but we'd like to enhance it and develop it further. So we're engaging with our current end users to understand improvements. We appreciate that there are wider data sets that we can incorporate and build into this, i.e. mental health, etc. So we'd like to start doing some of that work as well. We also want to embed the children and young people's health inequalities core 20+5 framework into this as well, which is on our backlog to start looking at. We want to bring in confidence intervals so that we can start to get a bit of a better understanding of the confidence that we can apply to some of the measures that we've got in there. We also want to try and bring it down, drill down further from PCN level down to GP practice level potentially, and to be able to do some of that, we're looking at a regression approach as an alternative to standard direct standardisation, because the numbers at the moment become so small, they're very hard to work with, and it's just basically blank nulls. So we're looking at a different approach to allow for that drill down further. And we appreciate that it might not be easy to translate some of the key findings from the tool. So we are thinking about almost a summary page that looks at salient points, key points for a certain population, etc., to help with that translation piece. And these are some of our other tools, models that other presenters have presented in the last 2 days. I believe I'm one of the last ones, so you might, if you've missed those, please get in touch. Happy to kind of share any of the content that's available for those. That's the end of my presentation. Thank you.